You are about to hear a history-making sound. The sound of a radio signal, man-made, transmitted from outer space. Listen, listen, listen.
Brennan McKenzie, welcome to the Prism Podcast. Welcome back to the Prism Podcast, I should say.
Yeah, he's an alum. He's a veteran.
I know. I put that on my resume now. Thanks for having me back.
Yeah. Well, that's why you're so famous.
Our pleasure.
Yeah, the most famous veterinarian you could get. I saw that.
In all fairness, we only reached out to 15 to 20. It's not.
Yeah,
don't feel bad. All right. So, Brennan, there's a couple reasons we wanted to chat with you. First and foremost, you've got a book out, which we'll get into. It's called Placebos for Pets, The Truth About Alternative Medicine in Animals. But also, there's this pandemic going on. And
yeah, I heard about that.
Yeah, it's kind of a big deal.
It's sweeping the nation.
It's washing over us like a wave, a tsunami. So I've been seeing in the news a few things. Starting several weeks ago, I think there was a pet dog that had been diagnosed somewhere in the world. But then I started hearing about cats, and then we had in the United States, the first dog that tested positive. And the CDC recently came out with guidelines about social distancing for pets. So I thought that this is something really important to get into. Lots of people have pets, and as I'm sure you've seen in the news, lots of people have pets they didn't have before the pandemic because
yes, indeed,
a mad dash for the shelters.
Yep, everybody is home a lot and wants to have some companionship, which is understandable, but impulse adoptions can lead to problems for sure.
Right, because what happens when the pandemic winds down? Do they keep the animals? Do they?
Exactly. Yeah, it's always a problem with any pet adoptions that people aren't always prepared for. The amount of commitment in terms of time and energy and finances for taking good care of a pet, and we see that around seasonal purchases, rabbits at Easter and dogs for Christmas, things like that. So I do have some anxieties. I think it's great that these pets are being adopted, and I certainly understand. My dogs are wonderful company for me when I'm locked up at home. But I do hope people understand that they're making a long-term commitment.
But are these animals going to give us COVID-19, Brennan? We have to know.
Almost certainly not. I mean, I'll start by saying that if you ever feel that there's a lack of adequate evidence in human medicine, you got no sympathy from me because we are always orders of magnitude less in veterinary medicine. So what I can tell you,
dentistry says hold my beer.
What I can tell you about coronavirus and COVID-19 in animals is there have been a handful of PCR positive cases in various species in different circumstances. There were a couple of dogs in Hong Kong initially that tested positive. There's been a dog in North Carolina, a couple of cats in New York, and a handful of others around the world. And almost all, but not all, almost all of the pets who have tested positive have been owned by people with confirmed or highly suspected COVID-19. So it's very likely they're getting it from their owners.
Well, let me jump in there. I guess devil's advocate, are they getting it from their owners?
Chicken or egg? The
DNA of their owners, because the DNA of the virus from the owners is just on the animal.
Well, it depends a little. Yeah, there are two separate questions. I mean, one, can the animals
It's RNA, though, isn't it?
It is RNA, yeah. Can animals be infected, and also can they serve as mechanical vectors or fomites? And those are sort of separate questions. We believe they can be infected. Most of the PCR positives are from nasal or rectal swabs, so it's internal genetic material. In cats in particular, there has been an experimental study deliberately infecting cats and showing that they do produce both an antibody response and a PCR positive, and they do show respiratory clinical symptoms. They can actually even transmit it to other cats indirectly through some side-by-side cages with some directed airflow, so not a totally natural transmission model. So I think it is likely that these animals are being infected. Dogs appear to be asymptomatic. Cats appear to have mild respiratory symptoms. There also were several tigers and a lion at the Bronx Zoo who've tested positive, who were being cared for by a keeper who turned out to be an asymptomatic COVID patient. So I think we've pretty well confirmed human to animal transmission. The core of your question is there animal to human transmission? And the answer is we've never seen it, but nobody is looking very hard. We know that this originated in bats, and we suspect an intermediate host in one of these animal markets in China. Nobody's quite nailed down what that was yet. And nobody has documented transmission from an animal to a human. It seems unlikely that this is a significant route of infection, because I think with the millions of people who've been infected around the world, if it were, we would know that by now. So there's no question that human-to-human transmission is the overwhelming, if not exclusive, source of this for people. But there is very little research. So I don't think we can say with absolute certainty that it's not possible to transmit it in the other direction. But I think there's, at this point, no evidence and no real suspicion that that's actually happening in the real world.
But how's that affecting your practices? I mean, I guess your practice, when you do see animals, you're more concerned about human-to-human contact as opposed to worrying about contracting it from pets. And obviously, you can't put N95 respirators on dogs or cats.
Right. So we've focused a little bit on both. The majority of our efforts at mitigation have been about reducing the potential for transmission between people. So clients, for example, are no longer allowed in our building. We've always been what's called an open hospital, which is kind of an unusual model in veterinary medicine. So our clients stay with their pets at any time, anywhere. They can sit in the ICU all day if they want. They can come in and watch surgery. You know, we have a sense that the relationship between us and our clients, and between the clients and the patient, works better if clients are present for whatever they want to be present for.
Sure.
And now we've had to say to people, you know, you have to hand your pet over to a nurse in PPE out in the parking lot, and you don't get to see them again until we release them. And that's been really difficult for us and for our clients, but that, I think, is a necessary step at this point.
Oh, of course.
Are
you getting much pushback from that?
Not very much. No, I have to say clients, you know, have been
Sure.
generally very understanding. And, you know, we make some exceptions. We do allow clients to be present for euthanasias. They wear masks. We wear PPE. So we do the best we can.
Sure.
In terms of whether or not pets are potentially a risk to our staff, which is a concern we have, we do obviously screen clients, and we rely on them to tell us whether they are COVID positive, or if they have some suspicion, or if they're under quarantine. We do have some protocols in place for cats who have respiratory symptoms and belong to people with confirmed or suspected COVID-19, just because there is some evidence that cats can become infected. We would like to be able to test those cats and know for sure whether they're harboring the virus. And unfortunately, at the moment, that's not really possible. There are very restrictive testing guidelines for animals. We've had to work through both the local and state health departments to figure out a protocol for when and how we can test. Some of the national laboratories do have PCR tests for cats and dogs. They haven't been validated in positive cases, because so far there have been very few positive cases. So we don't know for sure how accurate those tests are. And we are not allowed to run them until we've gone through a fairly rigorous series of steps in order to prove that it's justified, which so far hasn't ever been a condition we've been able to meet. And I think the main reason for that is partly that we don't want to use resources that are needed for testing humans, because there are currently not sufficient resources for doing that. And I think we also want to be cautious about freaking people out. If we do test a cat and it has, you know, coronavirus RNA, we still don't know if that's clinically relevant or a risk factor for people. So I think if we were willy-nilly testing animals with an unvalidated test, we might be doing more harm than good. So at this point, we are treating from households with known coronavirus infection in an isolation ward as potential vectors, but that comes up extremely rarely.
So for context, Brenda, in your area where you live, is it fairly prevalent in humans there? Have you gone through the wave yet, or have you guys been pretty flat?
Yes, I practice in Santa Clara County, California. So we had one of the first few cases in the country, and we have had I think a total of about 2,000 confirmed cases and a little over 100 deaths in the county so far. So we certainly do have it in the area. it's questionable what the true prevalence is. You may know that there was a prevalence study done out of Stanford in our area that suggested a 4 or 5% positive rate, but they recruited patients through Facebook, and there were a lot of problems with how that study was conducted. So I don't think a lot of people trust that prevalence. So it certainly is present in humans in our area. We were fortunate in that the county and then the state government reacted pretty quickly and pretty aggressively. So we have had a pretty flat curve, fortunately.
So, Brennan, back to the CDC's recent recommendations on social distancing for pets. What exactly does that entail for the average dog? I assume most it's going to affect dog owners because they're the ones who are going out for walks, more so than cat owners.
Yes, I mean, cat owners are being encouraged to keep their cats indoors. There was a study in Wuhan, in China, looking at the serologic prevalence in cats before and after the outbreak, and they did find about 15% of cats who were outdoors were positive. There are some questions about methodology as well, but it's possible that that they can acquire it that way. So cat owners are recommended to keep their cats indoors if they can. For dog owners, again, we think the risk of infection in dogs is extremely low, and we have no idea, but we suspect that transmission to humans is unlikely. A prudent precaution is to keep your dog away from other people and other dogs, to use the same general distance guidelines that you would use for yourself, to rule out even the smallest possibility that they could pick up the virus either through infection or indirectly as a mechanical vector and bring it home to you. I think that in general, that's doesn't seem to put too much of a burden on dog owners who want to go out for walks. They just have to, we've closed the dog parks in our area, and I think a lot of places have done that. And we just, discourage people from letting their dogs interact with other people or other dogs for the time being.
Butt sniffing's just going to have to wait.
Sadly, it's true.
Until we have a vaccine.
That's right.
Well, unfortunately, your excellent book went to print before all this. I don't know if you would have included a chapter about COVID-19 in your book, but let's talk about that for a little bit.
Sure.
Obviously, Clay and I have addressed all this pseudoscience, alternative medicine in the general population in humans. And of course, we've had you on the show before to talk about some of the things you've written about, but now you've codified it into one easy to read book. So what was the impetus for writing this book? You just tired of fighting with people and just said, read my book?
Well, I think there were a couple of motivators. I, initially started my blog about 11 years ago, and the idea there was I was putting a lot of time and energy into learning about alternative therapies and about the science and evidence associated with them, and educating my own clients who would come to me with questions about these therapies for their pets. And I thought, if I'm going to do all this work, I should make that available to other veterinary professionals and the broader public. So I started the blog, and little by little, there was interest in other places. I'm speaking at conferences and at universities and vet schools, and then eventually writing articles in both the veterinary journals and in some veterinary magazines. I have a monthly column on evidence-based medicine in a veterinary magazine where I talk a lot about these things. And so it was kind of a natural outgrowth of my desire to make the work that I was doing useful to other people, both veterinarians and veterinary nurses who are answering these questions from their own clients, and to pet owners who I think unfortunately have sources of information that are overwhelmingly biased in favor of questionable therapies. If you go online, the majority of the information you find is people who are selling the things and who are true believers, and it's hard to find good science-based information on these topics. So having put all of this time and energy into learning about it, I thought I should find a convenient, concise place to put it all and make it as readily available as widely as possible. I was approached by a publisher who had run across the blog and asked if I had an interest in sort of summarizing the 10 years of work I've done in this area in book form, and I jumped right on it, said sure.
Yeah, and it's really comprehensive. I mean, on one hand, it's kind of amazing to think that there's essentially every alternative form of treatment, chiropractic, homeopathy, acupuncture, herbal remedies, Reiki, I mean, you name it, that humans partake in. There are also versions of it for animals.
Well, of course, because the humans are just going to project that onto their
Right.
onto their pets.
Sure, absolutely. I mean, most of the clients that I see who are, inflicting these things on their pets or interested in them do so because they've had some personal experience. Almost everybody. I live in California, and it's an area where a lot of alternative therapies are quite popular, and lots of people have had acupuncture or been to the Chinese medicine vet or doctor for themselves, and they think these things have been helpful. So naturally, they're interested in applying them to their animals. There are also a handful of veterinarians who focus entirely on alternative therapies, and they market quite aggressively.
Yeah.
We've talked, I think, before about the problem of the infiltration of alternative therapies into academia and medical schools, and the same is happening in veterinary education. Alternative medicine provides products, so there are companies that make a good living selling products associated with this, and then they donate to veterinary schools who have a hard time turning down the resources, and in exchange for that, they get access to students, and students come out of school with the idea that these things are useful, and then they begin to offer them. So there's definitely the same set of circumstances, I think, in veterinary medicine leading to the use of these kind of methods.
Are there actual veterinary associations that are like Holistic Veterinary Association or anything that they are organized? Because in dentistry there are some Biological Dentists Association or the AOSH, I think, like Oral Systemic Health. And some of these kind of blend actual decent science with pretty woo science, which I think is the norm. But are there actual associations that hold conferences and have their own journals and stuff like that?
Absolutely, yeah. The largest is the American Holistic Veterinary Medical Association, and they have a membership in the probably many hundreds. They have millions of dollars a year as an operating budget. They're registered as a 501c3, so you can look at their finances, and they're very well funded, and they have funded integrative medicine programs at a couple of universities. They have conferences. They have a journal. There are all sorts of smaller organizations for individual modalities. There's a Academy of Veterinary Homeopathy. There's a Association for Chinese Veterinary Medicine. So there are quite a few smaller ones, but the AHVMA is by far the biggest and the most powerful. And one of the things I find disappointing is I was involved and still am in the Evidence-Based Veterinary Medicine Association, which is an organization that attempts to bring a rational science-based approach to looking at all veterinary therapies.
And I'm sure you have a budget in the millions and hundreds of thousands.
Absolutely, yes. Our membership and our finances are really quite sad in comparison to the holistic veterinary medicine world, because evidence-based medicine is not in and of itself a marketable product in the way that alternative therapies are.
Well, marketing is definitely the key word there, and it's funny, the overlap between veterinary medicine and human medicine. With those organizations, the marketing starts right with the name, Holistic Veterinary Association.
Yep.
That's very specifically chosen to give an idea that they treat the whole animal, right? Unlike you.
Right. I only treat the toes. I don't look at any other part of the animal, no matter what's wrong.
Symptoms, you throw
drugs at it, surgery, cut, burn. But I do like how in your book, Brennan, I'm kind of a philosophy nerd, so I love it that you start off just kind of with an overarching philosophical take on it. It's like, how do we know what's true? How do we, these epistemological questions that, can get really deep, and you can write a, entire series of books on that, but then kind of narrow it down to individual modalities.
It's nice. You're setting the scene for how people should approach these topics. It's a nice primer.
Yeah. One of the things that you said in your book is like that's alternative medical proponents very often argue among themselves just as vigorously as they do with, quote, evidence-based medicine. I've never seen a debate between two CAM, which is complementary alternative medicine providers. Like tonight on this show, we're going to see an acupuncturist debate a Reiki provider, and they just go at it tooth and nail.
Yeah, you don't see that. I wrote an article years ago about the "it's all good" fallacy in alternative medical practice, where like you so rarely see that. Just like you said, Grant, is it different in veterinary medicine?
Well, what's interesting about that is that I think those debates occur, but the community is very cohesive in terms of
Yeah.
their outward-facing marketing and appearance, because they see
Mhm.
themselves, part of the culture of alternative medicine is being sort of an oppressed minority
Yeah.
viewpoint,
Right.
fighting against the man, big pharma and industrial medicine and all the things that they call us. Well, and as I discussed in the book, I mean, there are some philosophical principles that show up in otherwise incompatible sort of approaches, alternative medicine approaches. Vitalism is a classic example. Many alternative
Mhm.
therapies ultimately incorporate some notion of an invisible spiritual force or energy that is critical to health and that is ignored by mechanistic reductionistic scientific medicine, and so has to be treated through some other spiritually centered means. And
Mhm.
whether you talk about that as the innate intelligence of chiropractic or the vital force of homeopathy or qi in alternative Chinese medicine, they're all sort of thinking of that in the same way. So they do have some philosophical commonalities, and obviously they have the commonality of standards of evidence being different. The idea that anecdotal evidence and
Mhm.
personal experience are probative is deeply rooted in the epistemology of alternative medicine,
Mhm.
and part of the rejection of science is that ultimately they don't believe that you should abandon what seems obviously true to you based on your own personal experience or intuition just for data, because they don't accept that fundamental principle. So there are some commonalities that link them together, but I agree an awful lot of it is also the marketing exigencies.
So, how often do you see this in your daily practice? I mean, you're out in California, which obviously is stereotypically full of woo, and how often? I mean, is that something you see fairly frequently? And when that does happen, how do you deal with it? I mean, now you can say buy my book, but face to face.
Well, as is always the case, part of the challenge is defining this stuff. So if you include, for example, dietary supplements or these days CBD oil as an alternative therapy, I see it every day, multiple times a day. I mean, there is hardly anyone who's not giving glucosamine to their elderly dog for arthritis or using CBD oil for virtually anything imaginable. If you are looking at some of the more exotic and extreme forms of alternative medicine, such as homeopathy, I've had a handful of clients in 20 years who are seriously
Sure.
committed to homeopathy. So it varies quite a bit. But the general idea that natural is safe and effective, and we want to start with natural things before we try, that is a routine, everyday viewpoint that I have to address with my clients, who are often very intelligent, very educated people, but who have a couple of fundamental misconceptions that I think are widespread and make alternative therapies a little more attractive.
So, Brennan, can we talk about the elephant in the room?
Sure, my room's kind of small. I don't think I have room for an elephant, but if you do, I'd be happy to chat about it.
And that elephant in the room is acupuncture.
Yes,
And
Yes,
so,
indeed.
you're a certified acupuncturist.
This is
yes.
true.
And so I mentioned that it's often the elephant in the room because many people who, realize homeopathy, is ridiculous. It violates fundamental laws of physics and chemistry. And they realize that things like Reiki are ridiculous. And there's a whole long list of things that are implausible, don't make sense. But acupuncture often is the one that even otherwise kind of skeptical people will say, but that's the one. That's the one that there's something to it. And
Sure.
Grant and I have talked about acupuncture before various times. I'm sure it's come up. And my personal stance is that there's really nothing to it. But yet in your book, you discuss training in it and administering it to animals. So what's your side of the acupuncture debate?
Sure. I love this topic for a couple of reasons. One is that, I obviously get a lot of angry responses from proponents of alternative therapies to my book and my blog. Um, and I find that the one area in which I get some of the most angry responses are fellow skeptics who interpret my position on acupuncture as being too soft. The only thing you hate more than an infidel is an apostate. And so I find this is a controversial topic. And I think, when explored clearly. I don't think my position is probably that different from yours, but I'll try to lay it out as best I can. The first is the concept of Chinese medicine. The traditional rationales for acupuncture are mystical folk nonsense and untestable scientifically and not something to be taken seriously. So
energy flowing through
channels and meridians and yin and yang and excess spleen and all of that stuff. If you're using that as a system for diagnosing and treating patients, then you've gone off the rails, and this has nothing to do with scientific medicine. On the other extreme, poking needles into tissue does things that can be measured, and it's not like Reiki where it has zero impact whatsoever. Clearly it has physiological impact.
Right. There's a biological.
The question then becomes, is what it does something that can be reliably and predictably harnessed for clinical benefit in patients? And that then, brings up a whole series of questions for how you test it and what models you use and all of that. The short answer is I think that acupuncture is almost certainly a placebo in almost all cases. I suspect there's probably a little bit of counter-irritant effect. If I have a pain in my elbow and I drop a hammer on my toe, I don't notice my elbow so much, and I suspect that needling probably has some of the same kind of impact on certain subjective outcome measures, pain and nausea and things like that. But I suspect for the most part it's entirely placebo. That said, I think it's reasonable, if you set aside all of the vitalist nonsense, to look at the impact of needling on tissue and see whether there is anything there. And it becomes very difficult to decide what the answer is because it's very hard to blind trials effectively. You can hardly ever blind the patient, and you can never blind the therapist as to whether they're doing quote unquote real or quote unquote placebo acupuncture. So it's very difficult to get the kind of concrete evidence that would allow you to make a really solid absolute statement about whether or not you're accomplishing anything. I also think that it's a case of a little bit of bait and switch. There are some things that are called acupuncture, which I'm not sure really have much to do with it other than involving needles. And the classic example is what's often called electroacupuncture. If you stick a needle in the tibial nerve and run a current through that, you can call that acupuncture, but really that's percutaneous electrical nerve stimulation. And that can be studied, and there is some interesting data on that potentially having useful effects for pain or for GI motility in anesthetized dogs using well-blinded studies and outcome measures. Is that acupuncture? Probably not really, but it tends to get grabbed by acupuncturists as an example of acupuncture because it involves needles, and then they do it and say that that's the same thing. So for the most part, I'm not super impressed by acupuncture and the evidence in terms of meaningful clinical benefit in everyday use, but I also think that it encompasses a whole bunch of things that range from plausible and unproven or difficult to test over to complete nonsense. And I think sometimes we're a little bit too facile in our dismissal of all of that as all the same thing.
I think when did you get this certification?
So the story behind the certification is there's a Dr. Narda Robinson, who's a veterinarian and also an osteopath, and she's done acupuncture for a long time. She's a professor at Colorado State at the vet school there. And she has become quite a polarizing figure because she's decided that she wants to practice evidence-based alternative medicine, which one could argue is an oxymoron.
It doesn't leave you much to do.
And I have to say that I think her intentions are good and her heart's in the right place. She's been very firm about rejecting homeopathy wholesale. She's been very firm about rejecting Chinese medicine, despite the fact that that's the acupuncture school she trained in. I think she's a little too ready to accept low-quality evidence for things like herbal therapies and nutritional supplements. So I think her approach is reasonable. I don't generally agree with her very often on the details. And so, of course, she's hated by both sides because she does things that we skeptics don't like, and she's too critical of the alternative therapies. So she started a course in what she calls veterinary medical acupuncture, where she says we're not going to talk about qi and meridians and all that stuff. We're going to talk about neurophysiologic stimulation and nerve stimulation and motor end plates and all of the sort of supposedly objective science-based physiological effects of acupuncture. So I said, okay, if I want to be fair, and the acupuncture literature is enormous, if I really want to put the time and energy into investigating it thoroughly and critically, why don't I take a class? Why don't I spend 6 months training in what is supposed to be science-based acupuncture, and let's see what we find. And I actually blogged this whole experience. So I have pages and pages on my blog about, analyzing the evidence that she presents to claim that all of this is actually legitimate science-based. And for the most part, I didn't find it very convincing or very compelling. So I use that primarily as a learning tool for me. Now, as to why I have done acupuncture in patients, that's the more controversial one. And that, I think, is a judgment call. And I totally understand why a lot of people don't accept my reasoning. As you pointed out, I live in an area where alternative therapies are popular, and there are several full-time Chinese medicine vets in my area. Acupuncture.
You can speak their language now.
Yeah, sadly. And acupuncture is very popular. So clients will come to me and say, I have this old dog with arthritis and he's limping and he can't get up the stairs and his legs don't work anymore. What do you think about acupuncture? And so what is traditionally done in our practice, where we don't have much in the way of alternative therapies, is we say, sure, go to the Chinese medicine vet and they'll do acupuncture for you. And what happens from there is that veterinarian stops their nonsteroidal medications and switches them to raw diets and forces them to stuff all of these untested, uncharacterized herbs down their dog's throat, and basically leads the client to abandoning any kind of rational science-based medicine. So once I did this training, even though I wasn't particularly convinced that acupuncture had a lot of value, I thought to myself, okay, if I can say to someone, here's something you're interested in, I will be upfront with you. I think it's probably a placebo. I do think the risks are pretty darn low. I mean, infections and pneumothoraces and things like that are really quite rare. So I think there's probably not a ton of risk, but I don't think there's probably much benefit either. If you really, really want to do it, and if you promise me that you will continue to take your pills, continue to do your blood work, lose weight, do physical therapy for your pet, do all of the other things that I think are more reasonable, sure, to do some acupuncture for your pet. And if that can protect my clients from the influence of some of these more extreme Chinese medicine vets, it feels like a reasonable compromise to me. I think some people feel like that's not entirely ethical, and I think it's fair to debate that. But for the most part, that was the approach I took. And I've probably treated 6 or 8 patients over the last 5 years. Doing that, it's not something that goes over well very often, because most people who are interested in acupuncture want the whole holistic thing, and so they're not going to do it that way anyway. But I've had a handful of clients who would do that, and I feel comfortable that that's a reasonable way to employ it without necessarily supporting it.
Yeah, I think that is a reasonable approach. I mean, I think definitely I can imagine, and I could even do it myself. I could come up with counter arguments, have a discussion about the ethics of that, but I don't think that isn't some egregious, unethical assault on your patients. So we definitely don't need to get too far into the weeds on that discussion.
But I think Clay, one of the problems with alternative medicine, especially with acupuncture or homeopathy, which in and of themselves are very low risk interventions. The risk is not no risk, but very, very low risk. The risk is more from a philosophical, ideological standpoint, that they give that the credit, like Brennan was saying, the magical. But you're going out of your way to say you can do this, but realize what's really happening here. Yeah. So that if it does work after acupuncture, they realize that was just maybe, probably nothing, but one small piece in the overall puzzle, and that doesn't necessarily follow that acupuncture works for all these other things or other magical.
Well, and it's an interesting sort of psychological study. I mean, I literally have a consent form that I make clients sign saying that there's no evidence that this is beneficial in animals, and that the theoretical reasoning behind it is very suspect. And of course, the question then I'm often asked is, well, does it work? You do it yourself, does it work? And of course, from a skeptical point of view, I have to say, I have no idea, because my personal experience isn't probative. The evidence doesn't suggest it works, but, what I see happening is not really reliable evidence anyway, so it doesn't matter. For what it's worth, subjectively, I don't really see much improvement when I do it as opposed to all the other things I do. But I will say that despite the caveats, despite my own sort of lack of enthusiasm for the value of it, about half the clients that I've used it with feel like it's made a dramatic difference. And I think that's interesting from a psychological point of view. It's very similar to the number of people I say, glucosamine, I hear you're using glucosamine. There's pretty good evidence at this point that it's not really useful for osteoarthritis in humans. And the very limited evidence we have in dogs, which is, 2 studies of about 30 dogs each, suggests it doesn't work. And everybody says, yeah, this dramatic difference. This is what we're up against in trying to promote science-based medicine, is that these individual experiences are highly persuasive psychologically, even when you begin by saying this is probably just a placebo and you're just seeing what you want to see.
Well, you can't. So that makes me think of this whole concept of deceptionless placebo, which is kind of a mythological entity that is promoted by one particular researcher at Harvard, Ted Kaptchik. And I would argue that what you're describing really isn't a deceptionless placebo. I mean, you're not deceiving, like you as the primary practitioner, but you don't know what those pet owners have been exposed to in their own communities. What you may be saying about how it's probably just placebo may be going in one ear and out the other because their Aunt Sally told them acupuncture is magic, and so they're totally vested.
Absolutely. I mean, all of the constellation of factors that lead us to believe something works, whether it does or not, are very complicated and involve a lot of things besides the explicit script that the practitioner gives you when they offer you the placebo.
Exactly. And from a communication standpoint, the fact that you have done this, communicating and trying to have a respectful discussion with someone whose views may not align exactly with yours. Part of it is kind of getting on the same side of the table and saying, here's what we have in common. Here's what we know. I respect where you're coming from because I've have these certifications or whatever. And then you can proceed from a place of trust, from a place of commonality, even if, down the road, 2 steps down the road, it separates, but at least you have a good starting place.
Absolutely. No, I think that's absolutely critical. I mean, and you've presumably read at least some of the book. That I take a tone which I think a lot of skeptics find insufficiently harsh, because it's written for the general public, even though it's referenced pretty heavily. So I hope practitioners will find it useful.
God, what 700-800 references? I mean, God.
But I think it's absolutely critical. As a clinician, my job is not to bash my clients' beliefs about things, because that doesn't make me an effective communicator. That doesn't give me the ability to intervene effectively in the welfare of their animals. So my job is to understand their point of view, to know as much as I can about these therapies so I can say, sure, I've heard of that herb and I know exactly why people think it works. Here's why I don't think it does. Here's what I think the risks are. But I'm taking this seriously because you are, and my job is to help guide you in making decisions. So yeah, I think you hit on something really important, which is that we have to reach out and communicate with the values and the goals of our clients or patients, in your case, if we have any hope of influencing their choices and providing effective care for them.
There was one more topic I thought we would get into, and then we'll wrap it up. So, Brennan, when we first talked about having you on the show, this was before the pandemic hit and things kind of got put on hold for a few weeks. But in the news at the time, I remember there were concerns about the effect of diet on dogs and their hearts. And you mentioned a raw food diet a few minutes ago, but I think this one was specifically is like a grain-free diet causing heart injury.
Yes. So one of the great examples in veterinary medicine of fads in human health bleeding over into my domain and causing trouble is the grain-free diet. This is largely an outgrowth of the gluten phobia that swept through our culture a few years back, and the argument that grains are not a natural food source for dogs and cats, and that they have, toxic properties, wheat belly and all of that sort of thing, influenced people's thinking about dog food as well as about, what they feed themselves. So there suddenly became this plethora of grain-free dog foods, which used carbohydrate sources other than corn and wheat, things like legumes and other things. And my initial response to that, with clients was, look, there's zero evidence that any of the risks of grains that you're hearing about are true. These diets have been tested and used for decades without any evidence of any harm. As long as your diet is complete and balanced and meets all of the established nutritional standards, I don't see any reason why a grain-free diet would be a problem, but I don't think there's any benefit to it either. And that was the messaging for several years, until we started to see clusters of cases reported to the FDA with a heart condition called dilated cardiomyopathy. These are dogs who developed, weak, floppy heart muscles and went into heart failure. And we actually diagnosed a couple of the earliest cases in California at our practice. I do echocardiograms, and so I got to see some of these dogs. And it's been association has been established now between this condition and feeding a grain-free diet. There are a few other factors. There are also what are called boutique diets, diets made by small companies that don't have a nutritionist on staff and don't have very much in the way of quality assurance mechanisms. Exotic protein sources, buffalo, kangaroo, things like that seem to show up more often in these cases than conventional protein sources like pork and chicken and beef. But what happened is we switched from well-established, well-understood ingredients in these foods to ingredients that hadn't been used for a long time, that we didn't have a lot of research evidence on. We thought that they met all the same nutritional standards, but we found that in at least a subset of dogs, they actually appear to lead to deficiency in the amino acid taurine, which leads to this severe, sometimes fatal heart disease. The heart condition seems to be reversible with a change in diet and with taurine supplementation in a lot of these cases. But the fact is, this is a classic example of jumping from something we knew and understood to something unknown and untested for reasons that were completely irrational, for the notions of what was natural and unnatural, and actually doing real harm, which took a while to discover.
And so this phenomenon only is occurring in dogs? You don't see this in cats?
Yeah, so almost all of the cases reported to the FDA have been dogs, and a large proportion of them have been certain breeds, particularly golden retrievers, who already have some unique features in their taurine metabolism that make them more susceptible to this. There have been some cat cases reported. The reporting quality is not great, and there haven't been prospective studies, so there are probably several causal factors at play all at the same time, and they haven't been sorted out yet. Suffer from taurine-deficient cardiomyopathy, but that was something discovered in the 80s by a cardiologist, Paul Payan at UC Davis. And taurine supplementation in feline diets is now universal, and so we almost never see that anymore. So this is primarily a problem for dogs because they aren't always supplemented with the appropriate amino acids in grain-free diets that apparently they need, which we didn't realize they were going to need.
So natural doesn't automatically equal good.
No, it is not necessarily safe or beneficial. And we can have this argument in extensive detail about how what is natural is simply what animals in the wild are able to find and capture and eat, and their incidence of disease and malnutrition is much higher than in our pet animals who are properly fed. So natural is certainly not healthier.
We don't see those animals though, so they don't count.
Doesn't affect us, right?
Well, Brennan, this is a great time to wrap things up. Your book is entitled Placebos for Pets, The Truth About Alternative Medicine in Animals. It can be purchased through Amazon and other book distributors, correct?
Yes, Amazon, Barnes & Noble, a few other places. There's an audiobook version. I had to listen to someone actually read my words for 6 hours, which was quite painful. But
who did they get to read it?
Well, I asked them when they started talking about an audiobook if they were going to have me read it, and they chuckled and said, no, we're going to have a professional actor do that. So it's a voice actor who does audiobooks, and I think he does a pretty good job. Some of the technical terminology is a little difficult for him because he's not used to saying it, but that's available for people who prefer to listen to their books.
Well, you have a good radio voice. So, well, thanks so much. If people want to contact you otherwise, you read your blog, other ways to get a hold of you, what's the best way for them to do it?
Yeah, you can go to SkepVet. There's a contact form. You can email me through the SkepVet blog, and I'm happy to talk to anybody who has questions about the book or any of these other subjects.
Wonderful. Well, we sure appreciate you coming on again for the second time, and stay safe during these unprecedented times.
Thank you. Enjoyed the conversation. You guys stay safe too.
Thanks, Brennan.